If we were able to liberate the data, what would it mean for me, my family, my children? What would it mean for society? What would it mean for other citizens? Most people are comfortable giving their data to be used for medical research or for finding cures for diseases. They'd like it to happen, and they don't often get the choice for it to happen. A few people are very concerned about privacy. They're concerned about their own personal life, and therefore they should be given the chance to have some kind of consent over what happens to their data. So I think, on balance, we will gain much more from liberating the data and putting it to good productive use than we will from overprotecting it and in some cases causing people harm because we couldn't get essential information about their medical condition or their medication history when we needed it. So the balance, I think, has to be followed very carefully. Going back to the banking era, when they started to go electronic, we worried about using ATM machines and credit cards, and we worried about exposures to us. And in fact, these are just absolutely routine now because we understand the balance of risk and reward much better. I think in healthcare, we've not quite got that degree of understanding yet. But I think it's just a matter of time and maybe a little bit of extra public debate. So why people are concerned about data privacy and data getting to the wrong hands. So one fear expressed is that the data may be sold to insurance companies. We can then use that to be prejudiced against you in some way because of a pre-existing health condition. But the laws that we have in our countries generally mitigate against that. And we have laws that basically make it in some cases illegal for people to be discriminated against based on pre-existing conditions. I guess there's also kind of more general concern that governments, if they have too much data about us, if they know too much about us across a range of activities, they can start to link the data. And again, although some societies really trust their government and are quite happy for that to happen, thinking perhaps about the Scandinavian countries where they have a very trusting relationship. In other countries that may not be the case, and they may feel rather more uncomfortable about allowing this to happen. So I'd say that the public debate has to move away from just looking at the risks and what might go wrong to a much more affirmative discussion about So, healthcare systems will definitely change. They have to change because they cannot continue in the way that they are. They were designed for a very different era when most healthcare systems were designed with the idea of infectious disease being the big challenge, and therefore the whole way they operate is based around this kind of medical model that we created at the beginning of the last century. We're now dealing with a new world where most people are dealing with chronic conditions or lifestyle-induced conditions, and that requires a different way of thinking about how we work with people, and it requires thinking about risk, medical risk. So we should be encouraging people to be much more proactive in thinking about their health so that the focus on prevention becomes really significant. If you go back long enough, 5,000 years, Hippocrates wrote about healthcare then, saying that in any healthcare situation there are three actors. There's the patient, the doctor, and the disease. And the duty of the doctor is to follow the science, which was a little bit different in those days, but the science nevertheless. The duty of the patient is to work with the doctor to defeat the disease. And I think we need to get quickly to this much more collaborative, mature discussion about how to work together rather than the paternalistic system that we've had before. They'll have much more rapid access to things that are happening in the medical world in a way that they can use them at the point of care. So better decision support systems when they're consulting with the patient. Hopefully they will be better informed because we'll have systems that can read all the medical literature and try and reduce it down to the essentials and the important facts. Hospitals need to change, and hospitals, as I said before, really were designed to cope with lots of people lying in beds with infectious disease, basically both looking after them but keeping them away from the rest of the population. I think with chronic diseases we can design hospitals which are much smaller, which are much more connected to the outside world through the use of telemedicine and patient monitoring. And we can make them just better places to be from a patient experience point of view. You know, easy to get to, easy to navigate through, less fearful. We can do a lot of interesting things to prepare people for hospital visit. And we can put the hospital into like it's just part of a whole health experience that starts with, let's say, a concern or a symptom, goes through some kind of consultation, hospital visit, then all the follow-up. That needs to be a seamless process, and it isn't today. So I think we can hopefully look forward to a much more pleasant experience as we go through the healthcare system than we sometimes have today.